Today, I am here with Tina Shiver, who is a functional medicine practitioner. So she started as a registered dietitian and has landed here.
So I started my practice 35 years ago. I had a good friend who was a therapist and started the first mind-body clinic. And so we went to become certified back in the day, and it opened up a whole new world for me.
We talk a lot about the gut-brain axis, and I know this is big for you. And so what is the significance of the gut-brain axis for people that don't even know what that means?
It's your brain communicating with your gut, or your gut communicating with your brain. All day long, there's communication going on.
How common are parasites?
And they were parasites that I was like, how in the world? One of them came from pork. One of them was obviously from food poisoning. Another one was, we're just not sure where, from bad water.
The last piece of this puzzle that I wanted to just see your thoughts on is the stress response. And so people that are in this ongoing chronic stress, what's that doing to the body?
Welcome to the Fig Tree Framework, a biopsychosocial, spiritual approach to mental health, where mental health meets mind, body, and spirit. Hosted by Tina Motley. Recorded and produced by Richmond Podcast Studio.
Today, I am here with Tina Shiver, who is a functional medicine practitioner. And I'm curious about her journey. So she started as a registered dietitian and has landed here. So I first want to ask, how did that happen and why?
So I started my practice 35 years ago, and it seems like I had so many people coming in that were so not well. They were pretty sick. And what I was giving them, the information that I learned in school, was not enough. It was a good foundation, but it wasn't enough information. I needed more knowledge as to why people were so out of balance. And so I had a good friend who was a therapist who worked at Retreat Hospital and started the first mind-body clinic.
Okay.
And she mentioned to me functional medicine, and I was like, that sounds interesting to me, because anything outside of the box was interesting.
Sure.
And so we went to become certified back in the day.
Okay.
And it opened up a whole new world for me. So it took what I had read about, and then it really focused in on, think about the person's story. Yeah. Look at their timeline. Look at what actually could have triggered their imbalance. And a lot of people never did that. They just Band-Aided it.
Sure.
And so there were no more Band-Aids, or if there were Band-Aids, they were short-lived.
Okay. When you say imbalance, what are you speaking of?
I probably have 3 or 4 people a day that come in that have digestive issues.
Okay.
SIBO, small intestinal bowel overgrowth, irritable bowel syndrome, you name it.
Okay.
They have GI issues.
Digestion. Okay.
Yes.
So let's just go straight for it. So we talk a lot about the gut-brain axis, and I know this is big for you. And so what is the significance of the gut-brain axis? For people that don't even know what that means, what does it mean?
So it's the connection, it's your brain communicating with your gut, or your gut communicating with your brain. Always, all day long.
Right.
There's communication going on. And that, your gut is all about digestion.
Right.
And if you're not digesting and absorbing, you're not getting the nutrients that go to the brain and play a huge role.
In mental health, it would seem.
Mental health, blood sugar regulation, hormone regulation, cognition.
Okay. So what are you generally seeing is going on in the gut?
Poor diet.
Okay. Food.
It's all food. Yeah. It's food. It's either poor diet, or it's an imbalance of boxed in diet, like following what is called a low-FODMAP food plan.
Okay.
That a lot of people today are following, and they get stuck in that, and they follow it for 2 years. And it's like, then they miss out on other nutrients.
Give an example, like the keto, or just
keto,
rigid?
Keto I've never been a big supporter of. And, it was studied in the 50s.
Okay.
And it's for kids with mild seizures. And it worked.
Okay.
And now it's for weight loss, and you don't hear that much about it anymore because you miss out on a lot of nutrients.
Right.
When you let go of a lot of carbs, those are nutrients. Those affect your microbiome.
Okay.
For sure, because they have bacteria, or they can help to make bacteria. Sorry, they're like prebiotics.
Okay.
So prebiotics are going to be fruits, vegetables, nuts and seeds, legumes, etc. Your body doesn't digest the fiber. It actually helps produce short-chain fatty acids, which in turn make good bacteria.
Okay. So the biome is bacteria?
So the biome is made up of, I think it's 37 trillion bacteria, which we used to say, scrub your body, no bacteria, it's bad for you.
Right.
And now they're like, bring it on.
Okay.
Right? Go play in the dirt.
Okay.
And eat food with dirt on it.
Why?
Because it helps feed your microbiome. It helps keep your system in balance. Now you can go too far and end up with disease.
Okay.
So you don't want a lot of bad bacteria. That's why you always want to have enough good bacteria to balance it off.
Okay.
And in our society, we tend not to. We've gotten so much better. The sauerkraut, the yogurt, all of that's good bacteria, the miso soup.
Okay. Which are probiotics, right?
Yes.
So we have the prebiotics are the fruits, the vegetables, the nuts, legumes, and then the probiotics naturally are
the kraut, the yogurt, the kefir.
Right.
The pickles, the pickles. But it's interesting, remember this, that the probiotics are transient. So if they're not replaced, if they're not constantly made, then bad bacteria is going to creep up. We all have bad bacteria in our system. Okay. The question is how high is it?
Okay. And how do we find that out?
There's a lot of, you can do a stool test.
Okay.
Is it 100% no?
Okay.
It's a foundation, and it gives you a baseline, and it doesn't tell you everything. It can't tell you all of the different of the different types of bacteria.
Okay. So let's say somebody comes to you and says, Tina, I am struggling with digestive issues. Where do you start?
If I can with a stool test.
Okay.
And or an elimination. So I take a look at their they do an assessment form. I take a look at what they've done and what's worked and what hasn't worked. And I listen to their story. You try to figure out, where was the trigger? Was it stress? Was it trauma? Was it a poor diet? Did it start when they were young? Was it never addressed? It's interesting. The nice thing about the stool test is it tells you if there are parasites. Well, the GI doc can do that also. Okay. So if they want to go that route, great. Always test, especially if you have GI issues, one way or the other, through a functional medicine doc or practitioner or a regular physician, GI physician. They'll run parasite tests or imbalanced bacteria tests.
How common are parasites?
I think in the history, and again, I don't do a ton of stool tests because I rely on the GI doc a lot. I've probably seen 10 come up, and they were parasites that I was like, how in the world? Like, one of them came from pork. Okay. One of them was obviously from food poisoning. Another one was from, we're just not sure where, from bad water. And normally they'll pass through. Right. So usually you have enough good bacteria in you in order to balance out those parasites and clear them. But a lot of times they get lodged. Yeah. Okay. So someone comes in. Maybe you refer to a doctor that you know, or however you get the stool sample, and you get that back. And then what? Diet. And they might have to go back to their GI doc to be treated, because sometimes it takes a heavy-duty antibiotic. Okay. Or an antimicrobial like SIBO, small intestinal bowel overgrowth, requires what is called Xifaxan. And it's really specific for that bacteria. Yeah. So, or you can go a natural route. I tend to lean towards the GI doc because they can get there faster. And then you can follow up with a natural treatment. You want to do both, and then you want to repair the gut wall lining.
Okay.
So the gut wall lining has probably been compromised if they have a lot of bad bacteria and or a parasite.
Okay. So bad bacteria, meaning what? What constitutes bad bacteria?
So think about C. diff.
Okay.
That's common in hospitals amongst the elderly.
Okay.
And C. diff, how it presents is basically you're going to the bathroom all day, 24. I mean, it's bad.
Okay.
And it's really hard to get rid of.
Okay.
But if a doc treats it correctly, which they do usually, then it could take months. But the key is to reinoculate, which means add a lot of good bacteria back in high doses. Yogurt's not enough.
So how do you do that? How do you add good bacteria?
So usually it's a supplement.
Okay.
And it's either refrigerated or not. You choose the right one for that specific bacteria.
So that kind of leads me to probiotics, because that's kind of like, oh, let's just take probiotics. And I know a lot of people taking probiotics without having any real idea of what's going on in their gut. What are your thoughts about that?
I'm learning new information, and I've always been on the fence. I'm a proponent of it because I see so many people with GI issues, and it actually can help them. But I've seen where it hasn't helped people, and they've gotten worse. Okay. And some of the research is now saying that if your body already has enough of that particular strain, or that they call it a phylum, then it can do more harm than good. So you usually just look at the most common ones. And you have to be really careful about probiotics. You don't want dead bugs. And they can be on the market. So I'm picky about what companies that I usually recommend. Okay. Because they do a lot of research, and I know that they have good probiotics.
Are there different bacterias in the different probiotics? And are you basing what you may say on the biome test?
On the stool test.
On the stool test.
Yes.
Okay. So whatever the stool test reveals in terms of bacteria in the gut is really what then what's the right word? That is how you decide what kind of probiotic to use?
I hate to say it's a guessing game because it's not correct, but it doesn't tell you exactly what strains. Okay. No, like it'll point in the direction of lactobacillus or bifidobacterium. Okay. But there's a lot of strains underneath that umbrella. Okay. So you have to be careful, and I normally go with the one that has been recommended by many of the companies that I use because they've studied it all day, every day. Right. They know that if you have this issue going on, for example, IBS, this can probably help. If you have ulcerative colitis, there was something I just read about ulcerative colitis. It was fascinating to me that actually they did a study on adding sourdough rye bread daily. It's the rye that actually allowed them to get better. It didn't cure the ulcerative colitis, but their system started to balance out. So they had less diarrhea, less blood in their stool, et cetera. It was fascinating. Right. And they're looking at certain types of bacteria that can help with that. And one of the ones that was out of balance is called hydrogen sulfide. And hydrogen sulfide is in the gut, in the small intestine. Okay. And it's part of SIBO, that small intestinal bowel overgrowth. And they're saying that things like eggs and cruciferous vegetables that are very sulfurous, that are full of sulfur, contribute to it. And UC, that is it causing UC? No, but it can exacerbate it. Okay.
So it's really depending on what the person comes in and presents with as to what food you may prescribe. Can you speak to that a little more?
I always try to do if I can, an elimination if they haven't done one.
Like fast? Complete fast? No?
No, basically get rid of sugar. Okay. Maybe wheat and gluten. Okay. If it's been an issue. What else? Dairy. Okay. Because dairy for some people, like the lactose, can be a problem. But what I want to do is give their gut a break and see if it makes any changes or difference whatsoever. And a lot of times they come in and they've already done that. So you're like, okay, we're not doing that again. But a lot of times they'll remove and they forget to repair.
Okay.
You have to repair. You remove it. You have to repair the gut wall lining.
How do you do that?
Over time. So you might have to go 3 months without dairy and wheat and gluten.
Okay.
And or you use like an L-glutamine, which is an amino acid. You use certain supplements that can help repair.
Okay.
Or you eat healthy. You eat the right kinds of food.
Yeah, let's just go there because so many people are not eating the right kind of food. And I was one of those people for years. And I ended up doing a Daniel fast. I don't know if you're familiar with that, but it was pretty much vegan.
Yeah.
And it changed my life. And I'm like, whoa, there's something really powerful to food here. Mood, sleep, energy. Can you talk a little bit more about what food is doing to our bodies?
So it's really interesting you say that about vegan because the paleo people claim meat and, the hunter-gatherers were not. They were gathering plants, berries, which is really interesting. So some of the Mediterranean diet is based on more of a vegetarian / pescatarian protocol. And the reason is because it feeds the microbiome. It is crucial to take in plants. So the carnivore diet and the paleo, you've got to be really careful. In the paleo, they include vegetables, but legumes are important. Plants are important. Fruits are important. Nuts and seeds are important because otherwise you're not going to feed your microbiome. And it's crucial to do that to balance out that bacteria.
Okay. So the trick is to balance the bacteria, not to get rid of the bacteria, because we need the bacteria, correct?
That's correct.
Okay.
And you're always going to have some bad bacteria in your system.
Okay.
It's never going to be 100% clean.
Okay.
Because plants have bacteria.
Sure.
Right?
Yeah.
People are like, well, what if it's organic? I'm like, it's probably more bacteria than non-organic.
Okay.
It's
interesting.
It's coming from the soil. It's probably
a good bacteria?
Possibly.
Okay. You just don't know. So if someone presents, they come and they have an imbalance, and I'm sure it changes for everybody, but what's the time frame? Like how long do you have to change your lifestyle?
So it's an interesting question because I used to be like, I want people to get better faster.
Right.
And that is not the way to go. And I made a lot of mistakes.
Okay.
People would come in, I'd be like, 30 days, you're going to be great. We're going to do all this. And people were overwhelmed.
Okay. It's too much too soon.
Too much too soon. So you have to meet them where they are. You might start with elimination. You might not. I might just do a healthy food plan just to get them on track and then introduce, let's do the next step. Because if they're not losing weight or their GI is not getting better, something's off. So it could take 3 months, 6 months, a year.
Okay.
At least.
And then a sustained lifestyle change, I'm assuming.
Mm-hmm. Yes.
Okay.
Yeah. So with the Daniel, for example, how long did you stay on it?
Oh, a couple years probably. And I still adhere to a lot of it. I've added some things back to it because I love cheese and I love different things. But, it was dependent on my system, really, because you can tell what is impacting you. I could anyway. After you have eaten clean for a while, you can certainly tell when you don't eat clean.
So that's the other reason why if you do an elimination, you start with a month.
Okay.
Because they can have a new baseline. They feel better.
Right.
And if the key is also to take in a ton of nutrients.
Okay.
So they have energy and they're not feeling like that the first 1 or 2 weeks, when you're removing everything and you're like, psychologically, et cetera, is playing a role.
So how do you do that? Or is that through supplements, taking in additional nutrients?
I might use certain detox powders, yes.
Okay.
And all that is, I used to say, well, it's cleansing your liver. And I'm like, wait a minute. Your liver naturally detoxifies.
Okay.
You're not doing anything to the liver. You're just adding a lot of nutrients to support that detoxification.
Okay.
Your body needs to be able to clear any medications you're taking, any hormones that you produce, whatever is any bacteria that you are taking in. You want your stool or your kidneys through urine to clear it. And so the more efficient your liver is, then the more you clear it.
Okay.
And the better you feel. So, the powder might have vitamin A, vitamin C, vitamin E, everything that you probably are already getting, but it's a higher dose so that you feel different.
Right. And
then oh, if I took in more foods with vitamin C and vitamin A, this is what it would feel like.
Right.
Because it does, I'm a big believer when people come in with a bag of supplements and they're not absorbing it, that is a waste of their money. And people spend a lot of money on supplements. And I'm a supporter of it, but not, with 20.
Right.
So how do you balance food and eat correctly and supplement it with a supplement?
Right. So when we're thinking about functional medicine, we're talking about getting to the root cause, number one, and we're talking about alternatives to optimal health, right?
Mm-hmm.
And so are there other areas that we're not hitting on? I mean, we focus on food, we've focused on probiotic, prebiotic. What other areas do you focus on?
So if they have had past trauma,
okay,
or they have a lot of stress or they have anxiety,
yeah,
therapist.
Right.
Or somebody who does meditation, but usually a therapist, because then the therapist will guide them to meditation, prayer, yoga, whatever they choose. They'll know. And that's their job. I work with a lot of therapists that really are open to the mind-body connection.
Right.
So it's not just about talk therapy.
Mm-hmm.
There's more to it than that. What else? So we've got therapy, and then we have possibly they haven't been to see a GI doc, so you point them in that direction. Trying to think of what else.
Yeah, it's pretty
exercise,
okay.
Movement, for sure. So a lot of people so think about it. I heard this the other day, a podcast on cardio, and cardiology surgeon said, what do you do to have a heart attack? And basically he said, you wake up in the morning, you have your coffee, you don't brush your teeth. He was going the opposite, right?
Sure, yeah.
And you go to work and you sit all day.
Right.
And then you go home and you sit and you eat sugar, you put sugar in your coffee, etc.
Right.
And that's how you have a heart attack.
Right.
And today we shouldn't be having heart attacks.
Okay. So diet, movement, exercise, engaging your body, taking care of your gut, which also means, I'm sure, lifestyle. What's the role of alcohol and water?
Right.
The liquids.
Yeah. So fluids are very important. I'm a big promoter of taking in plenty of water throughout the day, especially for the kidneys, so that they can detoxify. I'm careful about alcohol with people because, there's positives and negatives. And so there's more and more research coming out that it's not the best. So it's about how much and how much can they handle.
Okay.
And if they remove the alcohol, does their sugar intake go up?
Okay.
And that happens a lot. So how do you balance that as well? But I think it's recommended for women 1 to 2 drinks a day, if that.
Okay.
And if they've had breast cancer, it's not recommended at all.
Okay.
That's some of the new research.
Interesting.
It is interesting.
So I was told at one point that we should be drinking half of our body weight in water per day.
So I promote more.
Okay.
I do a test called the Impedimed test, which is looking at lean body mass and total body fat and total body water inside the cell and outside the cell.
Okay.
And it tells me whether or not a person is dehydrated. And most people are.
Yeah. Which doesn't dehydration have its own set of symptoms?
Hunger.
Okay.
Could mean that when you're hungry, you're really thirsty.
Okay.
And when you're not thirsty is when you're usually dehydrated. It's the opposite. So at least half your body weight.
Okay.
But I'm a big believer in at least start with 64.
Okay.
and then go up from there. And I know I require 80 to 90 because I'm outside a lot.
Right.
So you have to take that into consideration with the heat as well.
And what about the role of being outdoors and sun and vitamin D? You know, what speak to that a little?
So the recommendation is for most people to have vitamin D over 30 in their blood work, but now they want it over 50. And there's still a lot of controversy over that.
Okay.
I know a lot of my clients do not get all their D needs met through the sun.
Okay.
They don't absorb it.
Okay.
And it plays a role in the heart and also calcium absorption as well, along with K2.
Okay.
So if you're in the sun, you might want to test your vitamin D a couple of times, one at the end of the summer and then at the end of the winter.
Okay.
Just to compare.
Okay. And so on a yearly basis, let's just say, what do you feel people need to be tested for?
So definitely regular comprehensive. So to make sure that they're not anemic. So their hemoglobin, which is a comprehensive panel.
Okay.
Their metabolic rate. So their glucose, their hemoglobin A1C, which is a 3-month blood sugar average. Their B12.
Okay.
And what's the last one I'm thinking of? Vitamin D, of course, and then cholesterol.
Okay.
And some of the new research is showing that cholesterol is important. LDL is definitely important, but really what's important is the inflammatory markers. So what's inflamed, what's not, taking a look at your LDL a little bit deeper. And is it sticky? Or is it fluffy?
Okay.
Or how many particles are you sending into the arteries?
Okay.
And most cardiologists I've worked with in Richmond are really good at testing all that.
Okay.
So if you're not getting it through your primary, then you might want to go see a cardiologist.
Okay.
There's a lot of really good ones in Richmond.
Okay.
I think.
Okay. And you may not know the answer to this question, but I'm curious as to what you would say. The link in an unhealthy gut and mental health symptoms like depressions and anxiety, maybe even PTSD. I mean, are you seeing any links there?
Because serotonin, 80 to 90% is in your gut. And I believe there's dopamine in your gut too. And there's still a lot they don't know.
Right.
But I know that when people rebalance their diet, right, when they eat less sugar, they have less caffeine, they have blood sugar regulation by eating enough carbs, protein, and fat to stabilize the blood sugar, that they feel better overall. Is it gonna stop their depression? Not necessarily, but they can make better choices.
Right.
Because their blood sugar is not high and low.
Right.
So I think it's crucial. There are a lot of supplements that support depression, anxiety, that say that they're going to change depression and anxiety. And I'm a little bit, what's the word I'm looking for? I'm not confident.
Okay, you're skeptical. Yeah.
I'm skeptical because there's so many of them that affect the liver that I'm learning. And isn't there a deeper dive to take?
Right.
Right? Really crucial that I work with a therapist that I know what's going on with that person when I'm changing their diet, because what if I change it and that triggers something?
Yeah. So as mental health professionals, we are really adopting this whole person approach, very similar to the way you're talking, because we want to get to the root cause. We're understanding that mental health isn't just mental. It's often very physical. It's often social, right? And we would say also spiritual. So as mental health professionals, knowing what you know, when do we know, hey, maybe this person needs to be referred to a functional doctor, or maybe this person needs some blood work? How can we be better assessors?
So I'd say that should be part of your assessment form.
Okay.
Are you seeing a doctor regularly?
Okay.
And can I have contact with that physician?
Okay.
Because most physicians will talk to you. Whether a dietitian or a therapist, they will open that door. Talk to somebody. You could call a dietitian or somebody who's in the functional medicine world to say, yes, this might be a good fit for this functional medicine doctor, or maybe not. It might just be they need to see a primary care doctor.
Sure.
Get to know your primary care doctors.
Okay.
Because they're crucial and they will do anything to help in most cases.
Okay.
So I think that's important. And I think it's important to ask the patient, the client or the patient, do they get regular blood work?
Mm-hmm.
And if they don't, then you can direct it again to the primary care, or do they have a primary care?
Right.
I think that's, but then it brings you in the loop.
Yeah.
And you're not outside looking in saying, what can I do?
Right.
It helps the other practitioners a lot.
Okay.
You know more than we do. You're
about the story.
Yes.
Yeah. Well, and it's so, fascinating to read. I'm in the process of getting a doctorate. And so I read all the time. Wonderful. And so I read a lot about the vagus nerve, as we were talking about a little bit earlier, and how 80% of the information that our brain is getting is coming from our gut.
Right.
And so it makes us step back, with people, because we treat a lot of trauma that are stuck in that like fight, flight, that just central nervous system. And it's like trying to pull all the pieces together. Like, what of this is biological? What can we do in the body that impacts that, versus just talk therapy? Because I don't know that I believe talk therapy in and of itself is all that helpful if you're not engaging all the other aspects of a person. So from what again, back to the gut-brain axis, is there anything more you feel like would be helpful for people to understand how both are impacting the other?
How the gut and the brain?
Mm-hmm.
Food.
Okay. Back to food.
It really does go back to nutrients.
Okay.
I can't emphasize that enough because it affects the cognition. It affects the, your mental health, blood sugar regulation, everything we talked about before. Yeah. And if all of those are balanced, then I believe it helps you as a therapist go to a deeper level with them.
Right.
That it opens up the door for that trauma to be released.
Right.
Because they're getting everything they need balance-wise and with food. I don't know how else to say that. I know I see a lot of people that once they get their gut balanced and it's communicating brain, gut, digestion, food, and they're eating healthy, they tend to do deeper work with most therapists. They just do. It just opens the door for them.
Sure. Well, I guess when you don't feel well physically, you don't want to go unpack emotional trauma, right? Because that can also impact you physically. We're just back to the mind-body connection, and it's just, you can't separate them when it comes to human health, which I'm sure is why you've become a functional medicine practitioner.
So think about alcohol, people that are addicted to alcohol.
Okay.
They let go of the alcohol, and where do they go to?
Sugar.
And I see a lot of recovering alcoholics, and it's the toughest one to give up. And I believe now, based on some new reading that I've been doing, is that again, it goes back to the microbiome. I think that there is something there that we're missing that needs to be addressed.
When it comes to alcohol addiction? What are you thinking?
I think that there's something in the microbiome that's out of balance for most alcoholics. If you see that across the board with UC, with ulcerative colitis, that there's this particular microbiome that matches this person's microbiome that also has UC. Okay. And there's got to be something. And they're coming out more and more with probiotics that are geared towards mental health. And I'm like, I don't think it's there yet. Right. I think when they remove sugar, it's a whole new world for them. Can they hold on to that? I haven't seen it.
Okay, so let me make sure I'm understanding this correctly. You're saying your theory right now is that there's likely something going on in the gut that is maybe precipitating this person to develop an addiction to alcohol?
No.
Okay.
No. That I'm thinking about addiction to sugar.
To sugar.
Yeah.
Okay. So there's something going on in the biome that's creating the drive for sugar.
Which dopamine plays a role in
Got
that.
it. Okay.
As far as the neurotransmitter.
Okay.
Because sugar hits that dopamine site just like alcohol does. So I think that's why people are like, well, alcohol is going to get me in trouble.
Sure.
Sugar does not.
Right.
Yeah.
So then you were saying sugar is the hardest thing to give up.
Yes.
Okay.
Sorry, yeah.
That's okay. I just want to make sure I'm understanding because this is great information.
Yeah. Alcohol is not that it's easy to give up, but once somebody gives that up,
right,
they indulge in sugar.
Right.
Not always, but in most cases.
Interesting.
And so, and then there's weight gain.
Right.
And then now there's GLP.
Right.
So we still don't have answers.
Yeah.
It lights the brain. Sugar lights the brain up.
Okay.
It literally, they've shown that.
Okay. So addictive properties. I mean, right? Like we're responding in a positive way, even if it's temporary.
And what shuts down the microbiome? What causes an unhealthy gut-brain connection? Sugar, processed foods, too much meat.
Okay.
Like the carnivore diet would be a good example because there's not enough plants to offset it.
Okay.
Inflammation, which can come from too much meat, not enough plants, not enough balance.
Right. Balance is a word you've used a few times. It's just back to balance, which, you were saying a little bit earlier is maybe even some functional practitioners have gone a little too far over here because it's what we tend to do, right? We go from one to the other. So like, what's the balance? What does that mean? Not too much supplement, not too much,
5, what do they usually say a handful of supplements.
Okay.
But again, it depends on where that person is as far as their diagnosis, right? So if they have major GI issues, they might need more supplements, but not forever.
Right.
So many people come in and I'm like, why are you still on that supplement? And they're like, I don't know.
Okay. No one told them to stop.
No one told them to stop because that gets lost in the
story.
Thank you. Yeah. So the latest conference, the International Functional Medicine Conference, was just a couple of weeks ago. And one of the speakers was talking about gut-brain axis. And she said, somebody in this room one day is going to be 150 years old. That's how far we've come. But she said, here's the problem with that. They're not going to have a brain because of Alzheimer's and dementia and cognition. So decline in cognition starts, then comes dementia, then comes Alzheimer's. And it's on the rise. And so if we can't fix or change that, then it doesn't matter. If you live to be 110.
Sure, if you don't have your mind. Why are they speculating that these cognitive declines are on the rise? What's anybody taking a guess at why?
There's a lot they just don't know, right? And so diet, they believe, plays a huge role, and definitely stress and no movement. The 3 things that a person can change that they've shown has made an impact. Dr. Breedenson is a practitioner that's been working with Alzheimer's for years. He's seen a lot of, like, hormones can play a role as well. But definitely you change your diet, you start moving, even if it's gardening.
Sure. And
you change your stress level, and that in and of itself can make an impact on decreasing your chances.
Okay.
Like I know my mom's generation, they didn't move at all. There was no movement. They bowled.
Right.
But they didn't move like they're recommending today.
Which is what? What's the recommendation?
Different people say different things. Cardiologists say 7,000 steps. I say 10,000 steps at least a day.
Okay.
I'm a big promoter of movement.
Okay.
Women and men both strength train, especially as we age.
Weights.
Definitely weights. But is it what they're saying? No, I don't think you have to be a bodybuilder.
Sure.
Or
back to balance.
Yes.
Yeah. So eating well, which means no processed foods, really, probably. Yeah.
Really decrease your processed foods.
Yeah.
That's the recommendation. There's now saying, or the research that I just looked at said that children form their microbiome at age 3.
Which sets the stage. Yeah.
Yeah, it's pretty young, for sure. And they're now finding celiac at age 2 because they've been able to do a long-term study on that. It's really fascinating. So they're finding it early, which helps with the gut.
Sure. Okay, so peel back the processed foods as much as you possibly can. I mean, is there any processed food that's good for you?
Probably not.
Right. Okay. So lots of water, whole foods, Mediterranean diet because it's fish, because it's fresh, I would assume, from the ground.
And they just came out with a report, and National Geographic has the whole magazine is on Mediterranean.
Okay.
It's fantastic. Talks about polyphenols, olive oil, fish, etc. So.
Yes. Okay. So moving toward more of a Mediterranean diet, which is fish, chicken. Okay. But you're cutting out red meats.
Or having it not as often.
Okay.
Depending on your, and what's going on with your body.
Right. Okay. Anything else about the Mediterranean diet?
So, polyphenols, olive oil. So think about your plate as being half vegetables.
Okay.
Because that's going to feed the microbiome.
Right.
There's your fiber. There's your color. There's your phytonutrients.
Yeah.
All important for health. And then a little bit of protein.
Okay.
And then good fats.
Like avocados,
olive oil.
Olive oil not cooked, right?
Yeah, that's not supposed to be cooked. Yeah,
right.
Because of and the seed oils are very controversial these days. So think about seed oils. Part of that is, if people understood it, they're high in polyunsaturated fats. And so our diet over the years have become higher in poly and lower in omega. And so if you can switch it, then it's okay to have some seed oils in there. You just don't want refined, like soybean oil is probably not your best bet. I am a big believer in soy.
Okay.
A lot of people aren't, and I'm careful about that.
Okay.
If somebody has been through breast cancer and they're on tamoxifen, they're not supposed to have soy because of the interaction. But I think it has a lot of good properties if you choose non-processed.
Right.
As well. So you're looking at that, and that's Mediterranean as well. Beans, legumes, really high in fiber, really high in soluble fiber, which helps with pulling out bad cholesterol and balancing blood sugar as well.
Yeah. So we've talked a lot about diet. We've talked a lot about food. With the mind-body connection, are you seeing, and I don't want to beat a dead horse, but are you seeing, as people change the diet and as we pay more attention to our body and the impact that we have, that it's directly impacting or affecting our mental status, really?
People are definitely happier if their GI tract is happy.
Right.
So people come in and they're in pain or they're miserable because they're bloated or gassy or their GI tract is just not up to par. And so, that affects their mental health. They can go out.
Right.
And interact and connect with people. Right. Another really good one is connecting with people. Yeah. It's probably number one. Yeah. As I'm sure you know.
Yeah. Well, I think I mentioned to you, I had interviewed Kelly Lambert, and she was talking about that, that the dopamine is released when we're in connection. All of these things, using your hands, doing things, moving. She talked a lot about that as well, as people aren't moving, and we need to move our bodies and be interactive with other people, which is, again, our whole approach is social relationships have a lot to do with all of this too.
Yes.
And people are isolating these days, and they're not really engaging in meaningful connection with others and what that does to you. So it's the whole big picture. Is there anything else as a functional medicine practitioner you would want people to know about achieving optimal mental or physical health?
So I think it's important to know that you don't have to spend thousands of dollars in order to make that happen. Like, you can make some slight changes in your diet and be on the right path. Okay. And it is food, and it is movement, and it is stress reduction. And all of those you can do really without seeing somebody. If you can see somebody, it's great to have a guide,
Right.
and to know that you're either doing the right thing or you could take a different direction.
Right.
There are a lot of people that come in and see me that know a lot, and sometimes you have to re-guide them. They put them in a different direction, or, they're well on their way because they're so educated and they've read and listened, etc. You just have to be careful about hopping on a bus where you're taking a ton of supplements and you're not looking at your diet or your stress levels.
Okay.
You really want to be mindful of that.
Okay.
Don't grab the latest, like the keto is a great example of that. So many of my clients came in that were on that plan, and their cholesterol was like going up 3 times, and they were feeling low energy, and they just weren't feeling that good. So again, we go back to the balance.
Right. But it's good to go back to, because I think with anything in our field too, is we go all the way over here, then we have to come all the way back over here. And that's rarely the answer.
Right.
So, the last piece of this puzzle that I wanted to just see your thoughts on is the stress response. And so people that are in this ongoing chronic stress, what's that doing to the body?
So why does a zebra not have ulcers? Have you heard?
No.
It's a great book. It's a little sciencey, but so a zebra's out in the field, and what are they looking out for? A lion. So a lion or a mountain.
Sure.
And so they see the lion in their corner, and their body immediately goes into a sympathetic.
Yeah.
Right. So their blood thickens. They start their body starts retaining fat. They get ready for that attack.
Right.
The lion sees another zebra, so it goes in the other direction. This zebra goes right back into the parasympathetic.
Right.
We don't do that.
Why?
We stay in the sympathetic because we hold on to things. We don't want to let go of it. We live in the we live in the future and we live in the past.
Right.
We don't live in the present. So working with somebody to learn how to live in the present moment can decrease that sympathetic nervous system.
Which is mindfulness.
And
that's what we do a lot. It's, it's funny how all of our fields really do come together a lot, particularly with the stress response. I think a lot of people call trauma what really is a stress response. Not that they don't have commonalities, but I think you could live in a chronic stress response and not necessarily have had a traumatic event.
Right.
Back to the zebra, right? Like as humans, we want to make meaning. So that person or the animal was running towards us. Now, what did I do wrong? Why was I standing here? What were they thinking? Versus the zebra, it's like, I'm going to go finish eating my lunch. So I guess too, that's where our minds do get in the way of what our bodies could naturally do. And again, I don't know if I'm kind of going a little bit in a trail here, but for folks that stay in that activated state, that has to impact the gut.
It does. It shuts it down.
Okay.
Or either slows it down or shuts it down.
Okay.
And again, then people go on medications to help with that motility.
Yes.
When they really need to learn deep breathing, meditation, pray, whatever you teach them in order to be okay in the moment. A therapist one time told me, I'll never forget this. He's like, anxiety is not a bad thing. And I was like, why do you say that? He said, it's a red flag. And you shelf it, and it's always there, and you can always pull it down if you need it. But it's a red flag to know that something's wrong.
Right.
So therefore, then you don't want to ruminate, constantly go in the future and in the past, go back to the present. And let it go.
Right.
And know that everything's okay, or you're working on allowing things to be okay.
Yeah.
So, but yes, it does affect gut. It also, I would imagine, causes more food sensitivities because your gut wall lining becomes compromised.
Right.
You end up with that leaky gut.
Yeah.
And so a lot of toxins are coming in. And if you repair it, it gets better, but you can't repair it if you're constantly stressed.
Right. Which is back to the mind.
To work together.
Yeah, you have to work together. Okay. This has been incredibly helpful. Anything else you would want a listener to know about your approach or the way you see health, or even simple things people could do to move in the right direction?
Here's the thought. If they're not getting a lot of color in their diet, So what do they say? That look at your microbiome as a garden, and that you need to feed it. And so you have to start with the basics. And so the new information is saying diversity. So if you're eating the same thing every day, start with rotating other fruits or vegetables in there, other types of color. So if you eat broccoli every day, maybe switch it off with some cauliflower or cabbage, because that is going to give your gut microbiome a different type of fuel.
Okay.
So I think that's an easy one to pick up on. Peppers, or, think about the color of the rainbow.
Okay.
And start with one. It doesn't have to be 10. You don't have to go in your kitchen and clear everything out and throw it all away.
Right.
Start with what you have and make small changes as you go along. That's where I see people more successful.
Okay.
In the back of the day, I'd be like, clean it all out.
Right.
Because I didn't know any better.
Yeah.
But now it's like, wait a minute, we're human.
Yeah,
right?
you want a piece of cake sometimes.
Yes.
Yeah,
that's right.
Right.
That's true.
Sustainable. I mean, you're setting people up for success, right?
Yes.
I want to be able to sustain the lifestyle that I'm developing.
Yes.
Which isn't going to be perfect or completely, one way or another. Okay. Thank you, Tina, for taking the time to talk to me and just educate us on this. I think it's so hugely important for physical and mental health. Thank you for what you do and all the people that you help.
Yeah, thank you so much for having me. It's been
Absolutely.
great.
Yes.
It's been fun.
Thank you. Yeah, me too.